right. Hello, how are you today?
Good, how are you?
Good. So my name's Alyssa. How can I address you?
Claire.
Claire. Nice to meet you, Claire. So we're just going to do an abdominal exam today. So I'll have you just roll your shirt up, and kind of just tuck it underneath your sports bra. And then I'll have you put your feet flat on the, perfect, just kind of loosens up the abdominal muscles. So first we're going to start with inspection of your stomach using a tangential lighting, looking for any masses or herniations that would pop up, and looking for anything like that. Next we'll do auscultations. We'll just listen for the bowel sounds. So starting in the right lower quadrant, working my way around starting with the diaphragm. So make sure it's perfect. Just gonna feel it. Sorry, it might be a little cold. So starting listening for about 5 to 15 seconds. And if I didn't hear anything, I would listen for a little bit longer, up to 2 minutes. Good. Up here. Good. Perfect. And then I'll come back around or switch to the bell, listening for any friction rubs, starting with the liver here. Feel it up here. Good. Again, listening for 5 to 15 seconds. Then moving to the spleen on the side. Again, listening for any friction rub. Then I'll listen to the arteries in the abdominal area with the bell, listening for any brewing. So and starting with the renal arteries, we'll start on the left, which is just up a little bit from up and over from the umbilical or belly button. Good, and then we'll listen to the abdominal aorta, which is just straight up and over a little bit from the belly button. Good, then listening to the iliac artery, which is from the front of the hip diagonal with the belly button. Listening for any brewing, do it on the right side. Good, and then I'll just listen to the femoral artery, so perfect. Perfect, and then on this side. Good, okay. All right, and that all sounded good. Next we'll do some percussion. So just running with the 3 vertical lines, so from mid-clavicular sternum to the other side. So just tissue dragging. Listening for it to change from a resonance from the lungs to a dullness to a tympanic. Again. Belly button. Good. And then on this other side. Good. All right. Next we'll check for the border of the liver. So I'll just have you just create a tissue barrier for me. Lifting up straight, perfect. So trying to find the border of the liver, so going from the resonance to dullness. Oops, that's aggressive. Good, so right about there. Then coming up, listening for it to switch from tympanic to dullness, which is right about there. And liver border should be with between, I think, 6 and 12 centimeters. Anything larger than that would indicate an enlarged liver, which isn't the case for you, so that is good. Then we will percuss the spleen, which is in the lower, on the left side. So I'll have you lay on your left side, and I'm just gonna reach around here and listening for the spleen. And that all sounds good too. Listening to the changes and looks good. Next we'll go into, so I'll have a patient, I'll have you sit up facing the wall. And so I'm just gonna take one of my hands at the TL junction here and take a fist and hit the back of the patient over the hand, asking patient, did that cause any pain?
Nope.
Okay, and then doing it on the other side. Any pain with that?
Nope.
Good. And that would be Murphy's kidney punch, looking for any, it would cause pain if there was any issues with the kidneys. So next we'll go into palpation. So just starting with a simple rebound test. If there was any specific area of pain that the patient had, we'd we'd do the test on the opposite side, or not over the side of pain. So being she doesn't have any pain, and just press in and quickly release any pain.
Nope.
And if there was pain, or she was experiencing pain, it should localize the pain. All right, so next we'll just do superficial, starting with a superficial palpation, then we'll go to a deep palpation. Let me know if you feel any pain. So starting in the right lower quadrant, just feeling for any masses, anything that jumps out at me. Asking patient if there's any pain through it. No? Okay. Then we'll go to a little bit of a deeper touch. Kind of feel all of those abdominal organs. Any pain?
Nope.
No. Good. All right. Then from there, we'll just palpate the edge of the liver. So I'm just going to be facing towards the patient's feet, taking my fingers, and I'm just going to go right. I'll have you take a breath in, and I'm just going to go right under your rib cage here, see if I can feel the border of the liver. Yeah. Okay. So take a deep breath in, and then let it out. All right. And any pain with that? All right. Perfect. Then we'll feel for the gallbladder, so then I'll face the patient's head, and then I'll have patient take a deep breath in and let it out. Good. And any pain with that? No. Good. If there was, it could mean liver enlargement or gallbladder enlargement, cholecystitis, I think is the term. But anyway, there's no pain, so that's good. Let's see. Oh, and then that would be Murphy's inspiration for the gallbladder if there was any pain, which there wasn't. Right, so next we'll palpate for the spleen. So I'm just gonna take my cephalad hand, and I'm gonna place it behind your back. And then take my right hand or caudal hand, and I'll have you take a deep breath in and just kind of work my way in there, trying to capture that spleen. And on a normal patient, you shouldn't be able to feel it unless the spleen was enlarged, which isn't. So that's good. Then we'll do the kidney capture test. So the same thing. So just gonna place a hand on the back, and then have the patient take a deep breath in while lifting up and pressing down. Let it out. Good. And then on this side. So take a deep breath in. Let it out. just feeling for a slight movement of the kidney to feel it, but really hard to feel. So that's all good too. All right, so next we'll palpate the abdominal aorta. So just going up a little bit from the belly button and a little bit to the left. Trying to find it first, feeling it, and then pressing A to P, feeling for the borders of the aorta. There, and should be within 3 centimeters, which she is, and typically wouldn't do this on a normal, healthy human, but we would perform it on someone who is older, having cardiovascular disease, to feel for that and feel for an aortic aneurysm in the abdominal cavity. Next, we'll just do a couple special tests for the appendix. So starting with a rebound Rosving sign. So I'm just gonna place my hands on the lower left quadrant and let me know if you have any pain. Yeah, with that, nope. And if there was appendicitis, that would cause pain on the right lower side. Next we'll palpate McBurney's point, which is just a third of the way from the front of the hip and the belly button, and it's just blanked. And then just pressing in. Is there any pain with that? No. Okay. And if there, again, appendicitis, that would cause the patient pain. Next we'll do a psoas and obturator sign. So I'll have the patient flex their knee, hip and knee up to 90 degrees. I'll have the patient resist my hand, activating the psoas. Any pain with that? Nope. And if there was pain with that, it could be appendicitis. Then we'll check the obturator muscles. So internally and externally rotating the patient's leg, asking any pain. Okay. Which is negative. So she doesn't have appendicitis, but if she did, that would cause her pain as well with the activation of those muscles. And then that concludes our abdominal exam. All right.